Okay. We are group two, and we did Does staff training prevent workplace violence in healthcare? Our purpose was in healthcare staff, what is the effect of staff training compared with usual intervention on workplace violence? Now we'll go to Kylie for the background and methods.
Thanks, Olivia. So, for the background, healthcare staff in this case includes nursing staff, physicians, assistive personnel, and any other role involving patient care. This setting includes hospitals, clinics, and specialty areas such as emergency departments. This issue is relevant to nursing as workplace violence has negative impacts on the relationship between patients and nurses, and therefore has the potential to reduce the quality of care. It also has negative consequences on staff mental health, feelings of safety at work, and staff turnover rates. Addressing the issue of workplace violence in the healthcare setting allows for better outcomes for both healthcare staff and patients. And as for the methods, so the databases we searched included PubMed and CINAHL. Keywords were healthcare staff, workplace violence, prevention, and training. And articles that were published in 2020 or later were considered, and studies from the United States were given priority. And only interventional studies were considered so that they would have a higher level of evidence, and no protocol or pilot studies were included. And next, Gabe is going to discuss some of the results.
All right, so in our review, we analyzed 5 international studies published between 2021 to 2023, focused on the impact of training on workplace violence in healthcare settings. The studies varied in location and healthcare environments. One focused on forensic mental health settings, others on general hospital departments, and another on emergency departments. The types of training and interventions ranged from departmental training programs to data-driven prevention strategies. In terms of evidence, 4 out of the 5 studies were rated level 1B, which is considered strong evidence-based on well-designed randomized control trials or quasi-experimental methods with solid methodologies. Breaking down the data from the table from the studies, 2 studies showed inconclusive results, meaning they either didn't show statistically significant reduction in workplace violence or had limitations such as a small sample size or unclear measurement tools. For example, one study in forensic mental health setting didn't find strong enough evidence to confirm that training alone significantly reduced violent incidents. More on the results, Olivia's going to talk now.
So, 3 of the studies demonstrated improvement. One study in hospital departments reported a significant decrease in workplace violence incidents following training. Another showed that nurses had improved perceptions of violence levels and reported feeling more improvement, reinforcing the idea that high stress and high risk environments benefited from targeted staff training. Importantly, the results were statistically significant with a p-value of 0.05, meaning that there was only a 5% chance that the results were due to random variation, supporting the idea that the training was indeed effective. We also noticed that the type of structure of training mattered. Programs that incorporated regular updates, multidisciplinary improvement, and department-specific strategies tended to show better outcomes. Overall, while not every study showed a dramatic effect, the majority supported the idea that structured staff training is beneficial in reducing workplace violence and improving workplace safety in healthcare settings. So now we'll go to Benedicta to do the discussion.
Thank you, Olivia. So as observed from the results, staff training provided good evidence in reducing or at least preventing workplace violence in healthcare settings. So nurses should be involved or be active in the training process from design to evaluation. The limitations included inherent methodological flaws, varying measures, limited studies, and inconclusive findings from 2 studies as seen in the results. So next, we'll go to look for conclusion.
Thank you, Benedicta. So the overall conclusion from all of the studies observed was that staff training on workplace violence can be a good strategy to try to prevent it or make things better for the employees or the working staff. Um, it was also found that nursing leaders should advocate more for their staff, uh, for more safety training and education. But with that being said, it was also important that the workers themselves advocate for themselves to get that education. And for further studies, um, there should be a main focus on program evaluation and its long-term effects, as this will later and further enhance the benefit of healthcare workers whenever it comes to workplace violence.